Cervical cancer is a type of cancer that occurs in the cells of the cervix, the low part of the uterus that connects to the vagina. The most common cause of cervical cancer is persistent infection with high-risk strains of human papillomavirus, HPV, a sexually transmitted infection. Cervical cancer is a significant health concern, but it is also one of the most preventable and treatable forms of cancer when detected early. Causes and risk factors. HPV infection. Persistent infection with high-risk strains of HPV is a primary cause of cervical cancer. HPV is a common sexually transmitted infection, and most sexually active individuals will be infected at some point in their lives. Smoking. Women who smoke have a higher risk of developing cervical cancer compared to non-smokers. Smoking weakens the immune system and makes it harder for the body to fight off HPV infections. Weakened immune system. Individuals with a compromised immune system, such as those with HIV/AIDS or those taking immunosuppressive drugs, are at an increased risk of developing cervical cancer. Oral contraceptive use. Long-term use of oral contraceptives has been associated with an increased risk of cervical cancer. Multiple full-term pregnancies. Women who have had many full-term pregnancies may have an increased risk of cervical cancer. Family history. A family history of cervical cancer may increase the risk. Symptoms. In the early stages, cervical cancer may not cause noticeable symptoms. As the cancer progresses, symptoms may include abnormal vaginal bleeding, such as bleeding between periods, after sex, or after menopause. Pelvic pain or pain during intercourse. Unexplained weight loss and fatigue. Diagnosis. Pap smear. Regular Pap smears or Pap tests are crucial for detecting abnormal changes in the cervix that may lead to cervical cancer. HPV testing. High-risk HPV testing may be done alongside or following a Pap smear. Colposcopy. If abnormalities are detected, a colposcopy may be performed. This involves examining the cervix using a magnifying instrument. Biopsy. A small sample of cervical tissue may be taken for examination under a microscope to confirm the presence of cancerous cells. Staging. Cervical cancer is staged based on the extent of its spread. Stages range from 2000 to 4, with higher stages indicating more advanced disease. Treatment. Treatment options depend on the stage of cancer and may include surgery. Removal of the cancerous tissue or the entire uterus may be recommended. Radiation therapy. High-energy rays are used to target and destroy cancer cells. Chemotherapy. Medications are used to kill cancer cells or stop their growth. Immunotherapy. This treatment boosts the body's immune system to fight cancer cells. Prevention. HPV vaccination. Vaccines are available to protect against the most common high-risk HPV strains. Screening. Regular Pap smears and HPV testing can detect precancerous changes. Safe sex practices. Using condoms and practicing safe sex can reduce the risk of HPV transmission. Quit smoking. Smoking cessation can lower the risk of cervical cancer. Early detection through screening and vaccination against HPV are critical in preventing and managing cervical cancer. It is essential for women to have regular gynecological checkups and follow recommended screening guidelines to detect and treat cervical abnormalities early on.